Today we are going to talk about the Ebola virus. Ebola is a disease caused by viruses, which are sometimes called Ebola variants. The Ebola virus is a mononegavirus, meaning that it is a single-stranded, negatively charged RNA-based virus. Ebola is most prevalent in central regions of Africa, where Ebola virus carriers are most present. Ebola typically spreads through contact with the carrier or through transmission of bodily fluids, where the concentrations of the virus are much higher. Some strands of Ebola have a mortality rate of up to 90%, but thankfully, there have been no reported cases of Ebola this year, although there have been very few reported cases in 2012.
The virus mostly affects primary lymphoid organs, reticuloendothelial cells, which are cells responsible for filtering and taking care of bacteria. Hepatocytes, responsible for main functions of the liver, and phagocytes, which produce cytosines. Symptoms can last from 14 to 21 days. When phagocytic cells involved in the body's immune response come in contact with the virus, cytosines are released, causing harmful inflammations. Decimated intravascular coagulopathy, which is overactive blood clogging, can develop due to massive viremia, which is easy viral access to the bloodstream, and damage to the liver. Symptoms include headache, joint pain, a sore throat, weakness, and fever. This makes the virus very difficult to identify because these first symptoms are so similar to many other reactions to different viruses. As the infection progresses, the patient experiences coagulation abnormalities and severe bleeding, internal and external. They also may have stomach pain, vomiting, diarrhea, and patients deal with rashes, red eyes, and hiccups as well.
Currently, there is no commercially available cure for Ebola, but response towards infection should include strict isolation and heparin use and replacement of coagulatory factors to treat disseminatory intravascular coagulopathy. The current locations of reservoirs for Ebola are unknown, but certain methods have been established to prevent the spread of disease. Victims of the virus should be isolated by barriers, and tools should be sterilized after each use. Nursing staff must have full body protection when coming into contact with an infected patient, suit, mask, gloves, and goggles included. The Center for Disease Control and the World Health Organization have developed a set of hospital guidelines which describes how to recognize the symptoms of Ebola and how to prevent further transmission with locally available materials and little financial support. There is currently no vaccine available for animals as well as humans, seeing as other primates can also be infected. To take care of infected animals, procedures should involve handling fluids in animals with multiple layers of gloves, isolating the disease with barriers, and thoroughly cooking products as if they were to be consumed. The WHO has been involved in all past Ebola outbreaks by providing expertise and documentation to support disease investigation and control. No more monkey business. Help stop the spread of Ebola.